everyone, and welcome to today's webinar on planning sustainable health promotion programs. My name is Monica Nunez. I'm a knowledge exchange specialist at Public Health Ontario, and I have the pleasure of moderating today's webinar. I identify as a white cisgendered settler, and today I'm joining from Toronto, on the traditional territory of many First Nations, including the Mississaugas of the Credit, the Anishinaabe Nation, the Haudenosaunee Confederacy, and the Wendat peoples. Before we start with today's presentation, I'll mention a few housekeeping items. First, Zoom allows attendees to have the ability to customize their own view. You can do so in the right-hand corner of your own screen. If you have any questions during the session, please use the chat pod. And although we will save responses to questions until the end of the presentation, the chat pod has been enabled to encourage interactivity during the session. If at any point during the session you experience any technical issues, please email events@oahpp.ca. It's now my pleasure to introduce the speaker for today's presentation, Andrea Bodkin. Andrea Bodkin has worked in health promotion and public health since 2003 with a focus on program design and implementation, effective collaboration, and learning design. As Senior Program Specialist in Health Promotion with Public Health Ontario, Andrea brings her enthusiasm and expertise for planning in all forms, evaluation, community engagement, partnership development, and facilitation to public health units across Ontario. Andrea holds a master's degree in public health with a specialty in health promotion from Deakin University in Melbourne, Australia. Welcome, Andrea, and over to you.
Thank you. Thank you so much for being here, everyone. As Monica mentioned, my name is Andrea Bodkin, and I identify as a white cisgendered settler. And I have a lot of privileges that really affect how I view the world and even how I might view research. And those privileges include education, full-time employment, safe housing, stability, and all of those things that so many people take for granted and so many others don't have. Today I'm speaking to you from my home, of course, and I happen to be located beside the beautiful Don Valley and the Don River. And it's a really interesting place because there are records of human settlements in the Don going back, depending on the source you look at, between 7,000 and 10,000 years. There began settlements with small groups of nomadic hunters, and then Wendat peoples built longhouses, followed by the Haudenosaunee peoples establishing settlements in the Don. And as the Haudenosaunee withdrew south of Lake Ontario, the Mississaugas of the Credit settled the Don Valley. And later they, of course, were displaced to an Indian reservation near Hagersville, Ontario, where there is still a really vibrant community with over 2,500 members of the Mississaugas of the Credit. And through several hundred years of change and occupation of traditional territory, loss of culture, the trauma of residential schools in the 60s scoop, the Mississaugas of the Credit have endured, and they continue to adapt and grow into a resilient First Nation community. I also can't begin the webinar today without acknowledging a whole lot of people who helped, even though I get to be first author and have my name listed first on this published paper, a link of which is in the chat box for you. My second author, Sean Hakimi, obviously none of this could have happened without him. Sean unfortunately left PHO, but he is continuing his studies. He is currently working on a PhD at Queen's University. So just wanted to acknowledge all of the work that Sean put into this paper. We also had two incredible advisors, Kara Watson and Rachel Laxer. And of course, we can't say anything that we do at PHO without saying a huge shout out to our incredible library services. In particular, today, I want to say thanks to Monica for moderating, and for Lydia and for Amanda for all of their technical wisdom and guru-ness behind the scenes. Okay, so today we're here, all of you are here, to learn about this recent-ish research that was conducted on program sustainability. And in particular, what I'm hoping is that you're going to be able to identify how you can incorporate this research, not only into sustaining your programs, but perhaps even into planning them in the first place. I'm hoping that you're going to take away an understanding of what sustainability is and why it's so important, to be able to understand some definitions and frameworks that can guide your work, and also get some ideas about how to embed sustainability, as I mentioned, not only into sustainability planning, but into program planning itself. I'm going to do a short presentation today, then Monica and I are going to have a little conversation, and then you're going to have an opportunity to get into some small groups to actually talk through some of the things that you've heard and discuss how you could apply them, what might be holding you back, what ideas other people might have. So you all should have received a handout for the webinar. I will not be sharing slides for the presentation. You will see why as we go through. They're primarily pictures, but the handout that you received has all of the information that you could possibly want about the content of this webinar, including the reference list. And of course, you can also go to the source material, the article that was published in BMC Public Health almost a year ago. Again, a link for that is in the chat pod. And even if you just Google BMC Public Health plus Andrea Bodkin, it will come up. I know that I have checked. So let's start by finding out a little bit more about those of you on the line and your perceptions around program sustainability. Lydia is going to pull up a couple of polls for us so we can see what you think or how important you think program funding is in terms of program sustainability. Okay, amazing, everyone. Well, you've already passed the first part of the webinar. That's amazing. So yes, it is important, but it's certainly not the only important consideration. We'll get into some of those other important considerations in just a few minutes. And I think we have a second poll question. So here's a good one. When should you think about planning for the sustainability of your program? Okay, again, flying colors. You folks don't need to be here at all, but I'm sure glad that you did attend today's webinar. Thank you so much for answering those poll questions. Of course, in an ideal world, we want you to take a look at program planning, incorporating sustainability, thinking about the sustainability of your programs right from the very beginning. Awesome. Thank you so much for answering those poll questions. Okay, so let's start out with what program sustainability is. You've already guessed that program funding is only one tiny component of what sustainability is. One of the most foundational papers and pieces of research in the area of program sustainability was done by Shediak, Rizkala, and Bone in 1998. I'm going to be referring to their paper throughout because it's such a foundational paper. And while lots of people agree that continuing a program beyond financial security is important, it's really important to define, so what is it that you are trying to sustain? So in their definition, Shediak, Rizkala, and Bone talk about sustainability happening at 3 levels. So it can happen at the individual level, where the health benefits or the behavior changes or the change that you're trying to make through your program is maintained at the individual level after the program has finished. So if you were doing a diabetes management program, are people continuing with those behavior changes following the end of your program? The other level you can think about is that program activities are continued within the organizational structure. So think about this at the organizational level. So program activities are continued within an organizational structure so that the program goals, objectives, and approaches adapt to changing needs over time. So a great example of this is a program I was involved in several years ago called Go Girls Healthy Minds, Healthy Bodies, Healthy Minds. And originally the program was designed so that after the pilot project, another organization, Big Brothers Big Sisters, took the program over. And that was 16, 17 years ago. And in fact, Big Brothers Big Sisters is still continuing that program today. So that program has continued at the organizational level. The next level to think about is at the community level. So we can think about building the capacity of the community to continue the program after the original organization has finished it. The other thing that you can think about here are partnerships. Many times in health promotion, we work together with a whole group of community partners, and maybe it's that partnership itself that you want to sustain after the program funding has ended. So for the purposes of the systematic review and today's workshop, what we're really looking at is that second level, the organizational level. So the program itself continues either at the host organization or the founding organization or within some other kind of organizational structure. Now, one of the reasons it's so important to talk about this is that not all programs are sustained. And I think every one of you can probably attest to this. Anyone who's been in the field of health promotion and public health for longer than 5 years has probably seen programs come and go. And while this certainly wasn't the focus of our research, we did find a couple of references that talked about the number of programs that were sustained within 2 years of the funding ending or the funding being pulled. One article talked about 40 to 60% of programs do not last. The other talked about 40 to 60% of them lasting. So really we're looking at between 40 and 60% of programs don't survive after 2 years of funding. Now take that figure with a little bit of a grain of salt, because again, it wasn't the focus of our paper, but I think it gives you an idea of how often these programs come to an end prematurely. And this is really important because I love this quote: public health programs can only deliver the benefits that we intend for them to have if they're being fully implemented, if they actually reach maturity, and if those activities are sustained over time. And this is important because, as again, you have probably all seen in your practice, there were risks. There can be actual harms to not sustaining our program. So for example, the disease that the program was meant to address or the behavior the program was meant to change, it could remain or it could reoccur. We can also be wasting tremendous resources. And we're not just talking about financial resources here. It could be human resources. It could be community capacity and trust relationships. It could be space. It could be a whole variety of things that could be wasted tremendously if our programs aren't sustained. And then, of course, the loss of community support. And in particular, when you're looking at marginalized or vulnerable communities, there could be particular damage happening there. There was a paper that we included in the review, which I will talk about in a second, I promise, by Weisner et al. Such an interesting review, study, because it looked at health education programs in First Nations communities in Canada. And what they found was that a lot of the times these programs are funded to and hosted by universities or other organizations. And if they abruptly end or if they're inappropriately terminated, that can really diminish the community support and lack of trust with communities that tend to not have very trusting relationships with large organizations or academic institutions. So sometimes when the funding ends, those institutions leave the community. So not only does the program finish, but that relationship and any trust that had been built ends, and that can impact future programs. So I keep mentioning this systematic review. Let me talk a little bit about it. So we started this review a couple of years ago. I can't believe it's been that long. And it was published last fall in BMC Public Health. And as you've probably guessed from my slides already, I'm pretty passionate about having folks think about how can we keep these programs from disappearing? How can we keep these results, the community trust, and all of the things that we're trying to do? How can we keep that going? I was so interested in it that when I got here to PHO, I thought, oh, look, I have all these resources and these amazing people. Let's do a systematic review. So our research question was around the barriers and the facilitators that can influence the sustainability of health promotion programs. And in particular, what we're interested in is the factors that could be considered during the program planning process. So we did a systematic review. It was my very first, and if you've never done one, I highly recommend it. It was super amounts of fun. We, of course, developed some inclusion and exclusion criteria. We're pretty much looking at papers published in English. We had a very long time frame, 21 years, so that we could look at the sort of immediate results of that 1998 paper by Shidiak, Rizkala, and Bone that I mentioned a little earlier ago. We focused on studies that were about the sustainability of a health promotion program, and we did use a definition of a program from Public Health Ontario's program planning model, which I'll talk more about later. We looked at studies that explicitly used or referenced a sustainability framework or a model and had a definition of sustainability. Studies that specifically reported on facilitators or barriers for the sustainability of a program. And of course, we looked at synonyms for those two words as well. We included studies that had synthesis level research as well as primary level studies, and we also looked at the gray literature, specifically around facilitators and barriers to program sustainability. What we did not include was papers that were about sustainable development, sustainability of health systems, food systems, environmental sustainability, anything focused on sustaining organizations or systems or sectors. If the program took place in a clinical or hospital setting, because we really wanted this to be applicable to the work of public health folks within the province. And anything that was focused on the sustainability of a partnership or a coalition without a focus on program delivery. And of course, you can read more about our inclusion exclusion criteria, and in fact, our whole extremely comprehensive methods section, thanks to Sean, which is in our paper. So I just thought I'd show you the little Prisma chart here. So we did have two search strategies. We looked at published and gray literature. We did do quality appraisal on all full text. And we also developed a quality appraisal series of questions for the gray literature because we did want to make sure that there was good quality in the gray literature as well. We ended up with 16 included studies. Both Sean and I did do data extraction, and then we used a deductive thematic analysis to search for and identify common threads and compare them across all of those 16 studies. Then we used a great framework from Carroll et al. Called Best Fit Framework. It's a synthesis methodology where we coded the data using an a priori framework, so a previously designed framework that I'll talk more about later. And as I mentioned, we've got a super detailed method section in our paper. So we ended up with 16 papers. 6 of those were reviews, so systematic or literature reviews. 7 of them were primary studies. We had 2 workbooks and we had 1 sustainability framework. And across all of those 16 included papers, there were lots of different targeted outcomes. So there was a study about a diabetes program, obesity prevention programs, food insecurity, falls prevention, adolescent health, and asthma. There are other included papers that looked at the sustainability of health education research programs in Indigenous communities in Canada. That's the Wisner paper I mentioned already. In disadvantaged communities, in mental health, and in sports organizations. And while specifically we were looking, as I've mentioned already, the barriers and facilitators to program sustainability, we also wanted to take a look at results of the definitions and the frameworks. So the first thing that we looked at was the definition. Now, one thing that was really interesting is that all of the papers that we included and many of the papers that we did not include talked about how a lot of folks do not have a definition of sustainability. We sometimes sling this word around. We want sustainability, we want to sustain our program, but we don't always have a sense of what that means. And of course, we used for our paper, and a lot of other folks used, the Shediac-Rizkalun-Bone definition, sustaining at the individual, the organizational, or the community level. We also took a look at frameworks. All of the papers had frameworks. Of course they did, because it was an inclusion criteria. And out of the 16 papers, there were 13 unique frameworks. And there is a list of them in the BMC paper for those of you who love to look at frameworks. So once we took a look at those definitions and those frameworks, we started to take a look at the barriers and the facilitators to program sustainability. So as a result of our data extraction, we found 83 barriers, things that made program sustainability more difficult, and 191 facilitators, things that promoted the sustainability of the program. And then we applied an a priori framework. And we used one by Shell et al., and it has 9 domains to program sustainability. And this is the paper that provided the foundation for a tool called the PSAT, the Program Sustainability Assessment Tool, which is very commonly used in public health. And we found, though, that there were a lot of barriers and facilitators that did not fit into those 9 domains. So we developed 5 new categories to come up with a total of 14. And we referred to them as factors. We went around a lot trying to think of what is the best term that we want to use to talk about these things that influence sustainability. And we just came up with the word factors. So we have 14 factors for program sustainability. Then what we did is we took a look at frequency, importance, and relevance to try to weight these factors. So which ones have the most influence? So frequency was defined just by the sheer number of times that that factor was mentioned in the literature. Importance was measured by the study saying this particular factor, this particular barrier or facilitator was very important, was most important, had a high degree of influence, etc. And then the last one, relevance, was when we compared our list of 14 factors with Public Health Ontario's 6 steps to planning health promotion programs framework. And we took a look at how many of those factors appeared in the program planning framework. And that's how we determined relevance. So we came up with a total of 14 factors. And each of you in your handout are going to find a list of those 14 factors with a short definition of each one. So Monica, I think you had some questions about this paper.
Thanks. So my first question for you is, if a health promotion program planner asked you to distill the findings from your review into 3 points they should incorporate into their practice, what would you tell them?
Yeah, that's a great question. And Sean and I spent a lot of time because our paper, of course, we think it's fascinating. It's also extremely long and comprehensive. And so we spent a lot of time really trying to distill down what this research actually means for public health practice, for health promoters who are planning. And so we really do have 3 main messages. And I've already talked about actually all of them, and I will continue to talk about them for the rest of this webinar. So the first thing is to really be clear about what it is you're trying to sustain. Are you trying to sustain the behavior change or the resolution to the health issue or the effects of the policy that you're implementing? So that individual level, are you trying to sustain the whole program or part of that program within an organizational structure, either yours or somebody else's? Or is it something that you're doing at the community level? Are you trying to sustain the capacity of the community or the capacity of the partnership to take control of that program? And I know those categories are really broad. And when you're looking at your particular health promotion program, you're going to be able to come up with something a little bit more specific. What is it that you want to sustain? Again, going back to that consideration in the papers that a lot of folks don't have a definition of sustainability, which is the second thing, to actually come up with a definition or to adapt an existing definition because there are a lot of them. And again, this might need to be very specific to your program. So for instance, the paper that looked at changes in obesity, their definition of sustainability was very specific because they were looking for folks to stay within a particular weight range of the loss, 6 months, 12 months, 18 months after the program. So you might need to come up with something very particular to your program. And then the third thing is to really think about your program planning process and to embed as many of these factors into the program planning process as you possibly can, recognizing that a lot of them are already in current frameworks.
Fantastic. Now, was there anything in the results of your review that surprised you? And if so, how would those findings lead you to change or adapt how it is that you support planning for health promotion programs?
So what surprised me the most is that I wasn't surprised, in that if you had asked me to write down 14 things that influenced program planning, program sustainability, I probably could have written down most of these things. And actually, this webinar was originally intended to be a topic workshop, topic 2020, back when those things were possible. And one of the things I was going to do in the workshop is have people write down 14 things and then compare it to the list and see how many transfer over, because a lot of these are really what we would think about, making sure that we have the organizational capacity, the staffing, the resources, the physical spaces that we need, making sure that we have adequate planning, making sure that there is fit and alignment with the program and the community that we're trying to reach. One of the things that did surprise both Sean and I was that some of the things that were mentioned very frequently in the literature actually weren't in previous sustainability frameworks. So in this little chart that you have here, the asterisks represent the factors that weren't in the a priori framework, the Shell et al. Framework. So you can see community champion. This was a huge one. Almost every single paper mentioned how important it was to have a champion. Sometimes it's a political leader. Sometimes it was someone at the organization. Sometimes it was a community group. Sometimes it was community influencers, an imam, a priest, a mother's group that actually championed the program. So that was one of the things that surprised me a little. The other thing, and Eileen already mentioned this in the chat box, is that program implementation is really important, because if your program isn't implemented properly, you're not going to be able to tell if it's effective. And if you don't know if it's effective, you don't know if it should be sustained. And that actually brings me to another point, which is, I think a lot of the times we just assume that our work should be sustained. And I don't think we should always assume that. I mean, maybe the program didn't get the results we were looking for. Maybe it did, and it was just so astronomically wonderful that it's totally no longer needed. Are we really going to need, for example, a lot of hand washing programs post-COVID? I think many of us have gotten the message by now. And sometimes there's just something that doesn't work about the program, or the timing or the context has changed or something like that. So I think we never want to assume that our program should be sustained, or that all of the program should be sustained.
Thanks, Andrea. We've learned a lot about, what we're including as part of sustainability, but based on what you learned from this review, what do you think are the most significant gaps in current planning models?
Well, that just might segue me, Monica, over to my next slide. And what I did here is, and I mentioned this before, when we analyzed the factors for what we called relevance, and we used Public Health Ontario's 6-step program planning model. So that you'll see on the left-hand side of your screen. And then on the right-hand side, I tried to slot in the 14 factors. Some of these appear already in the program planning model. Sometimes it's quite implicit. And what I would really like is for folks to make as much of this explicit as possible. So for example, in step 1, managing the planning process. All program planning models are going to ask you to consider who should be involved. Should you have stakeholders? Should you have community groups? Should you have other organizations? Should you have people who oppose the kinds of behavior changes or disease risks that you're looking at, involve them in the program in order to kind of bring them on side? But they don't necessarily talk about actually establishing a formal partnership. So maybe using another framework to help you develop partnerships that would not only get you through the program planning model and the program implementation phase, but actually help you to sustain it. So I think really what's most important is to make a lot of this stuff explicit. And you'll see at the bottom of the right-hand side of your screen that program implementation, here's Eileen's point again, and program adaptation are things that that really are kind of in the next phase after you've planned your program. So making sure that your program is implemented fully and making sure that your program can adapt for changing circumstances. So maybe the context has changed, maybe the behavior has changed slightly and you need to adapt the program. Maybe the program needs to be adapted for a different population or a different community. So that's something that you consider as well. Okay, thanks, Monica. Those were tough questions. So now we're going to throw it over to you, the audience, for you to think about some questions. So we're going to put you into some breakout groups. You'll have about 10 minutes or so in groups of 5 or 6, I think we landed on, Lydia. And we have some questions for you to consider. Now, just the Zoom technology, we can actually put these questions into your breakout rooms. So if you're the kind of person that likes to write things down, you might want to jot these down. They're also in the email that Lydia sent out to you yesterday. And you might actually take your conversation in a slightly different direction, and that's totally fine. We just thought we would give you a few things to think about. So as you're looking at your handout, you're looking at those 14 factors and the definitions of each of those. Which of those factors do you already have explicitly mentioned in the program planning process that you use? Recognizing that not everyone uses the PHO model, though you probably, I hope lots of you do. So which of the factors do you already consider? And are there other factors that you could consider in the future? So are there some that you aren't currently using that you would like to think about, and how might you implement those? So one of the ones I'd highly encourage, and I mentioned this already, is the notion of having a champion. So how might that work for the particular program that you're looking at? And then what factors might be the most challenging? Which ones do you look at and you think, oh, Andrea, there's no way that I could do that? Are there ways that you could mitigate that? And maybe other people in your group have suggestions. So we're just going to give you a little bit of free time. Again, you can look at these 3 questions, or you can have a free-flowing discussion. Just think about these 14 factors, the definitions of sustainability, the frameworks. How could you put those into your program planning processes? So I'm going to turn everything over to Lydia here, who is going to do some magic with small groups. You will have a timer countdown in your small groups, and when your small group is over, you'll come back into this large meeting room, and we'll do some Q&A, some other fun wrap-up stuff. I hope that you enjoyed speaking to some other people, maybe seeing some different faces. I don't know about you all, but for my own experience, it's nice to talk to some new people every now and then. So we may have a little bit of time for you to share in the chat box how your discussion was, and in particular, if you had any questions. We will be moving on to Q&A in just a couple minutes, and so far we have one very excellent question, so we certainly have time for you to put some more into the chat box. All right, so I thought I'd start to move us towards a little bit of a wrap up, and we sort of cheated a little bit because Monica actually asked me this question not too long ago when she was quizzing me a little bit about the results of the paper. So really, we just wanted to leave you with a solid sense of what some of your next steps could be, how you could really incorporate some of this research into your practice. And as I mentioned, there's really 3 things that Sean and I thought about a lot as a result of what we found in the literature. So the first is to be very explicit about what it is that you want to sustain. Is it something at the individual, organizational, or community level? Is it a particular aspect of the program that went really well? Is it a particular partnership that you want to sustain? You don't have to sustain everything. So think about what it is that you would want to continue. And then next, to select or to create or adapt a definition of sustainability. So what does it mean specifically for your program? And to either select or adapt a framework or a model. And as I mentioned, we did have 13 unique frameworks that were in the studies that we included in the paper. They are all listed in the paper, and they provide some really excellent guidance. The third thing is to plan your health promotion program with sustainability in mind. And I'm actually just going to segue right over to Nicole's excellent question. And Nicole's question was, do we need to put all 14 of these factors into our program planning? It's a lot of stuff. It's a really great question, Nicole. And one of the reasons that Sean and I analyzed all of those factors that we found by frequency, relevance, and importance is we wanted to have a sense of weight. Were there some factors that were more important than others? That if you can only do a few, what are they? So in the actual paper, we actually put them in order, and we slotted the factors into 3 tiers. So in the first tier, those are the factors that seem to have the most influence. And those factors are organizational capacity, partnerships, strategic planning, funding, obviously, fit and alignment, program evaluation, capacity building, and having a champion. So that kind of gives you a sense of how you might be able to prioritize the 14 factors, because you might not be able to get at all of them. There also might be some that might be more or less relevant depending on the kind of program that you're doing. So if you're doing a program that really involves community partnerships heavily, so relationships with the community or relationships with other organizations, then you might need to put a lot more emphasis into that. If you're doing something that is really, perhaps it's a study or a pilot program that's heavily tied to evaluation, you might want to put more emphasis on having the indicators that you can easily measure, that you can clearly communicate. So I hope that answers your question. Monica, do we have others?
Yes, we do have other questions. There were a couple of comments, though, report back comments from the breakout rooms. Would you like to hear those first?
Oh, I'd love to. Thanks.
Okay, so first, Eileen, she mentioned we identified staff turnover as barriers to sustainability.
Yeah, that was one of, so while we had 14 sort of big baskets, within each of those baskets, there were some sub details, and you'll find that in the paper. And staff turnover was a huge one. And I think that was in the organizational capacity basket. So Eileen, once again, you hit it right on the head there. Staff turnover is a main thing.
Another comment from the breakout rooms was, one main challenge we had was defining sustainability within the organization, its values, and making it meaningful to the users of the program.
Yeah, and I think one of the things that might be important to distinguish, Rachel, and I'm not sure if this applies or not, but organizational sustainability and program sustainability are a little bit different. And an organization might have different priorities for sustaining itself than a program might. And for instance, when you look at organizational sustainability, you're going to need a lot of involvement by the board of directors. You're going to need a whole different level of thought and action and research, whereas when you're looking at the program level. But if there's a real big disconnect between the organization and its program, one of the things that you might want to look at is some of the results around the fit and alignment factor, because fit and alignment, it can mean several different things. One of the things that it means is making sure that the community to whom you're aiming the program, it's actually something that they want and it meets a need and it's a gap and all of that thing. But the other thing that you really need to make sure is that there is alignment between the mandate of the programs, the goal of the program, and the mandate of the organization. Because we see all the time, sometimes it's really tempting. Someone's offering you money to do a program and you're like, I'll take the money. I need to sustain my organization. But if there isn't an alignment with the values of the organization, with a mandate, with the mission, with the vision, it's going to be really difficult. And there may come a time down the road where that organization has to make some pretty difficult decisions about, no, we're not the right people to have this program. We need to look for someone else, which may work out well, or you can't find anyone else and the program isn't sustained. So I hope that addresses your question, comment, Rachel. But I think that that's a really important thing to look at.
Thanks, Andrea. So one last reflection from the breakout rooms and then another question for you. So first, The reflection. We talked about program adaptation in case of pandemic or another unexpected event, and how differing values can affect partnerships and commitment.
Yeah. And I think that the pandemic has given us, I mean, we published this paper before the pandemic, for those of us who remember what was before the pandemic. But I think that the pandemic has really shown us how we can adapt. We're all doing stuff online. Some stuff works well, some stuff doesn't. A lot of people have really critically been thinking about the way that they run their programs and adapting them, making them more sustainable by getting them online. And I think you have part two of your comment there, Marie, which is that the factors are similar to those that are found in a risk assessment framework. That's really interesting. I hadn't considered that, but now that you say it, I would think that program sustainability or a lack thereof could be a huge risk to an organization. And I did talk about the risk to not sustaining programs, but it was more kind of at the community effect impact level, whereas you're really thinking about the organizational risk, maybe resources, reputation, et cetera. That's really interesting. I love that thought.
And a question for you, Andrea. For the new factor fit alignment, is the organization in the definition alignment between the health promotion program and the organization's mandate and core business, referencing the organization delivering the health promotion program or the potential partner organizations?
Yes. So all of those. So definitely between the host organization and the program. So we talked about that with Rachel's point. And then also with potential partners. And I think I've done a lot of work in partnership development and coalition building. And this is one of the things that you will also find on any partnership development framework, is to make sure that they might use different words, but just to continue the terminology used in this paper, that there is fit and alignment between the mandate of the program or the mandate of the partnership and the mandate of the organization. Because if there isn't that fit and alignment, sometime down the road, you might have a lot of difficulty. It might be obvious right away that the partners aren't all on board. If my priority is physical activity and you ask me to join a tobacco coalition, I'm going to come and I'm going to do my best, but I might not have the level of commitment and enthusiasm that I might for a physical activity program, and vice versa. So I think you really need to pay attention to fit in alignment with everyone who is involved in the program, the organization, the partners, the community, the funders, etc. Great question.
And Nicole just commented 6+.
Oh, wow.
Nicole, feel free to elaborate, or if there's any additional context that you want to share for that comment.
Maybe she's giving us a mark out of 5, Monica. That might be how I interpret it.
I like that. Okay, one question, one other comment from the breakout rooms from Liliana, saying we talked about program evaluation and capacity for evaluation to assess outcomes, targets, and feasibility of continuing programs with return on investment over long term, often challenging when concepts like happiness cannot be directly measured like weight.
Yeah, that is a really great one. And when you take a look at the paper in the section around evaluation, I'm actually just going to flip to it right now, if I may, because I want to have it in front of me. It's not only are you measuring the right things and are you able to measure it, it's really also about communicating the public. So there's kind of 2 related things. One is around public health impacts. And so that is being able to clearly demonstrate the public health impacts of the programs, that the benefits of the program were clear, and that there was a clear understanding of the need for the program. So I think you could kind of read it into that. And then I think you could also read it into the sort of indicators, the evaluation framework. And I think it's a really interrelated question between program planning, sustainability planning, and evaluation planning, because I think we have things that we would like to be able to measure, and then things that are really difficult too. You know, I'm thinking about, and I think it might be Einstein's quote, but I also might be misattributing this. So let me know if you recognize it, folks. But not everything that can be counted counts, and not everything that can be counted, not everything that counts can be counted, something like that. So I think that's a really interesting thing to think about. I really love that comment. Thanks for making it.
So, and Catherine also just added that they also talked about how several of these factors are included in our program planning, but not from the lens of sustainability, but more so current-day success of implementation. That one also crossed my mind throughout your presentation, Andrea.
Yeah, I think that's a really good point, is that even though the factors are included, the lens might be slightly different. So thanks for making that. It's a really good point.
So, if any others have any additional questions or reflections that came from your breakout room, feel free to type them in. We still have a couple more minutes. But otherwise, thank you so much for the participation so far to get the conversation going.
Yeah, it's been terrific. And if I may plug just a little bit, one of the things that I'm really interested in doing is thinking about PHO 6-step program planning model and how it could be adapted or how it could evolve to make some of these sustainability factors more explicit in the model. So if this is something that you're interested in, you know, if you want to chat about it or if you have some ideas, I'd encourage you to please be in touch. You can find me on Twitter at Andrea Bodkin, and my email address is andrea.bodkin@aohpp.ca. So keep those questions coming in case we do have another moment or two, but I do have to say thank you to a whole group of people, Sean, Kara, library, and Rachel Laxer, as I mentioned, the co-author, fantastic library services, and the advisors on this paper. I also have to say a huge thank you to Monica for moderating, and also Lydia and Amanda for making all the Zoom technology happen. And in particular, thank you to all of you for attending this webinar. It's just been fantastic to see so many people. Please do be in touch. I'd love to hear from you.
Thanks, Andrea. As we wrap up today's webinar, just want to send a huge thank you to Andrea for presenting, and also thank everyone who joined today's session. It's great to see such strong virtual participation even during some of these challenging times. Just so you know, to access past presentations and view confirmed upcoming sessions, including a repeat of today's sold out session, please visit PHO's website, head to education and events, and you can get some more information there. Lastly, please expect to receive the brief and anonymous survey for today's webinar shortly. Please try to complete this to help us improve our programming and its sustainability. So thank you and have a wonderful afternoon.
Thanks, everyone.